My name's Simon Heller. I'm a diabetes physician and clinical academic at the University of Sheffield in the north of England. So I've been asked to talk about the purpose of drawing up a global map which is reporting the frequency of hypoglycemia in different countries. I think the idea for this actually started from a survey that Novo Nordisk did as a research project, where they invited people with diabetes to fill in an online survey which measured hypoglycemia both retrospectively and prospectively. There were quite big differences in different parts of the world. Actually, I think the purpose of the map is twofold. I think it helps health services to benchmark themselves against different countries to see just how frequent hypoglycemia it is. And I think the second purpose is to draw attention to the fact that this is an important side effect which has consequences both for families and actually for health services, because treating hypoglycemia and its consequences can be expensive. What the survey showed in type 1 diabetes, that there were really marked disparities between different countries. And I guess the question is whether that is an artifact. By that I mean, are the people who have problems with hypoglycemia more likely to volunteer to take part? Or are they real differences because of different healthcare practices as they pertain to diabetes in different countries? So this survey seemed to suggest, for example, that in Latin America and in Russia, rates of hypoglycemia in type 1 diabetes are much higher. What was interesting is that if we looked at the type 2 figures, they weren't quite so different. There were still some changes, but by and large, hypoglycemia as a side effect of treatment was not altogether that different. I guess the other question is, why might that be the case? It's probably down to an understanding of hypoglycemia. It may be due to the amount of resource that different health economies have in what they devote both to educating healthcare professionals and possibly different types of therapy.